All right, I am an orthopedic specialist, and I'm going to tell you, do not see an orthopedic surgeon if you have this type of knee pain. First, I'm not a surgeon, right? By training, I'm a non-surgical orthopedic specialist, so my bias naturally is to not do surgery. Second, there is a very good place, very good time to do surgery. I see it every week in my office, seeing new patients, that, hey, they come in, they have a complete tear of a ligament, they have a complete tear of a tendon, they have a knee that unfortunately is so far down the path of degeneration with knee arthritis that the best and most transformational thing they can get is a new knee or a new hip or potentially a new shoulder. And so there's very good reasons to get surgery, but I want to tell you the reasons not to get surgery or maybe not see a surgeon, because at the end of the day, surgeons do surgery. At the end of the day, non-surgeons don't do surgery. So I've spent all of my time, all of my career, all of my training, all my ongoing training, applying all the things we possibly can to keep you away from surgery if you're not in that category where you absolutely know already that you need surgery, okay? So to look at that on the broad scope of things, how do we do this in my office? One, it always starts with a concrete diagnosis of what is the problem. Two, what are the things that we're going to start stacking around your body to help it heal naturally? Okay, so that in our office is going to be doing a deep dive on your movement correction. This is where we have you working with a physical therapist. This is where we have you working with a movement corrective exercise specialist. This could be a sports-specific trainer to the activity that you do. If you don't have those people, we'll introduce you to those people. It could look at your nutrition. So again, people in my office come in, and from a nutritional standpoint, they may not be aware that a lot of the things that they're consuming on a day-to-day basis may be stoking the inflammation and the pain that they have. So we're a little unique in our orthopedic practice that we talk a lot of nutrition in my practice. We're gonna talk to people about what are the substances going in your body, what's the triggered output that could have from an inflammation standpoint. What are the corrective things that we could be doing for inflammation in the body? Things that I have sitting over here over my shoulder, things like curcumin, things like CBD, things like collagen, things like glucosamine, chondroitin sulfate, all of those things that I've discussed a little bit in other videos, we stack that around the problem, right? Then we get to interventional things. This is where, when I talk about why not to see a surgeon, it's going to be very obvious. Those three things I mentioned are very obvious reasons people go to surgery, right? Full ligament tears, full tendon tears, end-stage arthritis in the knee. The rest of the things oftentimes do not go to surgery. 70% of the time in my training, when I trained through orthopedics, we could get those patients better without surgery. 30% of the cases that walked in absolutely had one of those three things that needed to go immediately to surgery. So if you're in that 70% category, you probably want to work with somebody that focuses on that 70%. Why? One, they're going to have all the tools available to you. Two, they're going to have a higher level of interest in your case probably. Again, no offense to my colleagues, because I have a lot of great colleagues that I refer to for surgeries, but they love doing surgery. They love being in the OR. They love doing those things. And if it's not surgical, then it's kind of a very quick algorithm of treatments that we would put patients through in my training. It's anti-inflammatories, maybe it's a cortisone shot, it's off to physical therapy, and off you go. And there's just a lot more we could do, as I already shared in this video, that if we want to dig in at a deep level and help your body heal and recover, we need to understand the physiology inside your body. This is where this integrative world of functional medicine comes into play in my practice, where you're not just an orthopedic piece, right? You're not just a bone, ligament, or tendon. You're a walking chemical sack of reactions, chemical reactions. A lot of those things are dictated by your daily habits and rituals and nutrition and a lot of other things. But if we're just pushing all that aside like it doesn't exist, to then hyper-focus on just these structural elements of your knee, well, we're missing a huge part of the puzzle for a lot of patients. Because I can give you an example of a patient who came in to see me, this was probably 4 years back. Really great patient, really plugged in on her health. She had gained some weight. She was getting herself back in shape. She was changing her nutrition. She was walking a ton up and down this mountain range near her, and her knees were just aching, like debilitating aching. And she came in to see us. She'd already done some research. She knew she wasn't in a category that she needed surgery. Somebody had done x-rays already. They said, hey, you have great space in your knees, way too good to think about a surgical replacement like a knee replacement. But she wasn't given a lot of tools other than the standard conventional pathway. Anti-inflammatory medications, offered a steroid shot, but she didn't want a steroid shot because she knew some of the side effects already, that it could be detrimental to her health, and she didn't want to put that stuff in her body. And 3, she didn't have a surgical direction. She wasn't a surgical candidate, so they said, hey, just go to physical therapy. Well, physical therapy was able to aid her in her process because she was able to restore some of her movement patterns, work on the efficiency of some of her movement patterns, build up some of the strength. But even when she started to build strength, she started to get limited because of the pain, which brought her to my office, directed by that physical therapist to see her. But she was convinced, doing research, that she needed stem cell therapy. And stem cell therapy is a powerful tool we use in non-surgical orthopedics. We can take stem cells out of your body, put them back in the area that needs help healing, and stimulate it to heal. And she was absolutely convinced she needed this. But we put her x-rays up, we looked at them. Space was great in her knee, mobility was great in her knee, stability was great in her knee. We looked at her with ultrasound, we didn't see anything else funny there. Nothing to me clinically said, hey, we need additional diagnostics in the orthopedic space to look at her knees at a deeper level. But we started to analyze her health, her total health picture. And what we found out in the context of her doing all this walking, she was also doing a lot of changes to her diet. And she was trying to get more protein, and to get more protein in a healthy way, she was consuming a ton more dairy products. And so she was really loading up on cottage cheese and yogurt and other cheese and dairy. And what I suggested to her is like a little fast from dairy. Because what I knew and what I discovered in my training, this was after my orthopedic training, but in my functional medicine training, is that things like dairy can be quite inflammatory for people. Things like grains can be quite inflammatory for people. Things like nightshade vegetables, like tomatoes and peppers and white potatoes, things like that can be inflammatory for a third of the population. So as I looked at our nutritional intake that we do on patients, I saw some of those patterns that she was eating a lot of that stuff while she was really cranking up her activity. And I was kind of convinced that maybe that was the issue. In a matter of 3 weeks, when she went off some of these foods, took a break from them, her knee pain went away. So this is just an example of seeing the right person at the right time. And if you would have seen me, or she would have seen me maybe 6 years prior to that, I wouldn't have had that knowledge to share with her and take her down a different pathway. And if she would have landed in another office and said, hey, I got bad knees, they hurt, and I want stem cells, maybe that office, maybe that practitioner would have put stem cells in her knee. And I'm not convinced it would have helped her. And so to this day, she has not needed stem cells. She's dropped, I think, last time we checked in with her, more than 50 pounds. Her knee pain's gone. She's continued to kind of work on some of those things with her diet, and had really found out that those were big triggers for her. So the reason I'm putting all this out there today, and specifically around the who to see and when to see them, is one, you always want to see somebody early in the process. Like any disease process, if we can see you earlier in it, we're going to be more successful getting you out of that situation before it's too darn far down this hill and we just have less options for you. The second piece around that is, are you seeing somebody with the specialized knowledge and skill and experience that you need that's aligned with what you want, right? So I'll say that again. You need to seek out a practitioner that knows the things that you want, right? If you're interested in things like a functional medicine, integrative approach to orthopedics, I can tell you there's not very many practices that do that. I think we're unique in our combination of how we do this in our practice. And that was out of necessity for myself when I was healing out of my own injury back in 2012 to learn at a deeper level, how does this nutritional physiology impact my ability to heal? So that's why we brought that into my practice, was my own experience. Second, if that person doesn't possess a lot of knowledge, a lot of experience, a lot of repetition doing these things you want, they may not be that good at them. They could be using older technology, older treatment protocols, things that just haven't advanced at the pace at which science and technology is advancing. So you may be getting an old version of stem cell therapy or platelet therapy. So the reason I wanted to share this today is that there's a lot of patients that are seeking these kind of treatments, and when I'm talking about the treatments, I'm talking about platelets and stem cells and things in the regenerative orthopedic space. You really have to understand what you're getting. You really have to understand what the training of the practitioner is, the technology they use, the techniques they use, and make sure they're really progressing these at the pace at which we're understanding and guiding our treatments based on the evidence that's out there. So again, the number one reason not to see a surgeon is you got a problem that you already know doesn't need surgery, right? So then you want to find yourself into an office with a non-surgical orthopedic, preferably somebody with some integrative functional training like I have, that can give you the full scope, right? What are all the things you can put around the pieces of this puzzle that we can fit them in there, get you better, get you healthier at the same time, and keep you doing what you love doing. So if this video helped you in any way, hit the like button. If you want to see more content like this as we put it out, subscribe so you can see our future videos. If you have any comments or questions about what I shared today, put them in the comments. My team's great at answering as many as we can for people. And if we can help you in any way, in the notes, there's a link to a form that you can fill out and talk with somebody on my team where they can take a deeper dive with your situation and we can give you some direction, whether you're local here in Tucson where we are or anywhere else watching this.